So if you expect that communication is going to be completely seamless at all times, then you will be disappointed. But there will be communications issues, and then it's a matter of figuring out the solutions to them. And that might entail calling upon people to help clarify and advocating for yourself.
I think families should also expect, when they're in the hospital, to be asked to tell about their child's illness over and over and over again.
Mm-hmm.
And this may seem really tedious. It may seem that healthcare professionals don't know what they're doing or don't know the child. That is not the case. Healthcare professionals review the medical record before working with a child, and then they go and talk with parents or the child directly and ask what the medical history is, because they like to hear it firsthand themselves. So I have been in situations, I've been with a family in the emergency department where they were asked 4 times in a row to tell what brought them to the hospital and tell me about your child. And then after the 4th interview, the mother was very succinct and good at telling the highlights. And I said, but wait, I worked with this family for almost a year. You're missing so many important details. And so that's another thing that people could expect, is that caregivers really do care about your child as a whole person. But sometimes the line of questioning may be very directed at their illness, because that's the job of the doctor, to really figure out the illness. So it's not that they don't care. Mm-hmm. It's just they have a limited amount of time, and for a doctor, they want to make your child to feel more comfortable, or to figure out how they can best help in the situation. And so as a chaplain, I have the great luxury of time and am able to hear the richness of people's stories, but that's not the case for everyone. Mm-hmm. But definitely expect to be asked to tell multiple times, and even daily, for starting in the morning and going through the day, for doctors and nurses to say, how are, either to the patient, how are you feeling, or to the family, how's your child feeling, and asking very, very personal information that might feel even uncomfortable to say out loud. They're going to ask things about bowel movements and how many times has this child eaten and taken in liquids, and so I would say to families, if you feel put off guard, just to ask, is there a reason you're asking me this? Or is there a reason I've just answered these questions from the last clinician? Is there a reason you're asking me? Just, if you're wondering, just ask. I do want to say, I want to acknowledge that there's a power, it feels like there's a power difference between staff who wear ID badges and then families. Yeah. And families don't know what the rules are. They so when I say, if you have a question, just ask, that's easier said than done. It's easy for me, as someone wearing a hospital badge, to say, oh, just ask. I acknowledge that there is a power differential, and that it's hard as a parent to ask.
I think so.